also ensuring that everybody understands Busoga Health Forum. Ladies and gentlemen, we welcome you to Busoga Health Forum. My name is Alan Katamba Semakula. I am a director integrated with USAID UHA project. I'm in charge of integrated health service delivery, and I'll be your moderator for today. Ladies and gentlemen, allow me introduce our presenter. Our presenter is Dr. Harriet Birabwa Oketcho. She is a senior consultant psychiatrist from Butabika Hospital. Dr. Birabwa is a clinician who has a lot of interest in mood disorders, stress management, and the role of spirituality in mental illness. Dr. Birabwa has done a lot of work around ensuring that people get their psychological issues sorted. So we feel like she is the right person to take us through this very, very important topic pertaining to the mental health care for health workers. Dr. Birabwa, we're delighted to have you on Busoga Health Forum today, and the whole team is listening in and waiting to get enriched with your presentation. Dr. Birabwa, welcome to Busoga Health Forum, and the floor is yours now.
Thank you, Dr. Alan, for that introduction. May I please be allowed to share my slide, my screen?
Yes, Doctor, you have the powers too.
Okay. All right. Thank you very much, and thank you all who have tuned in to listen to this talk. I've been introduced already as Dr. Harriet Birabwa, but Birabwa Oketcho, but I need to add on something to this introduction. I think I've been a camolist on the Busoga Health Forum for some time. I joined when I was involved in some preparations, but I never left, though I've not been active. The reason why I did not leave is because actually I consider myself a Busoga. Having studied in Budini Girls for 6 years and then Iganga Secondary School for all my O and A levels, and then being adopted by my former headmaster, Mr. David Peter Chintu. All that makes me feel like, yes, I'm a Busoga. Era ndimu ise chisuyi. Era nsimi ino kuba wano. Thank you so much for welcoming me. When I was asked by Dr. Richard Impango to present something on this forum, of course, I was eager as a part of contributing back to Busoga. I decided to talk about mental health care for health workers. This is a little bit broad, and seeing the objectives of Busoga Health Forum related in evidence-based. We may not have a lot of evidence for this, so I'll share broadly, maybe specifically, maybe with examples, and maybe I even wanted it to be more thought-provoking for all of us, so that those who are doing research can actually go out and see what do the mental health, what do the healthcare workers need in terms of healthcare. So I'm not talking so much like an expert in this area, but I think I want this presentation to be able to generate some discussions along mental health care. That's the outline of my presentation. Please don't think that I am abusing your intelligence by starting with that slide, but I think it's still important because many times we know the definition of health, but we probably don't know the definition of mental health. According to WHO, mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So there's actually no health without mental health. WHO further says that actually mental health involves being able to connect. Are you having positive relationships with others? Are you contributing to the community like this forum is doing? Do you get a sense of belonging out of probably the Busoga Health Forum? Do you empathize with others? What about being able to function? Are you able to apply the cognitive skills that you have? Are you able to earn a living? Are you able to make health choices and learn new skills? Are you able to deal with stress and adapt to change and make complex decisions? As health workers, sometimes we are required to make complex decisions. Are we able to understand and manage our emotions? Are we thriving? There are times I feel like I should get away from surviving to thriving, by realizing my ability, finding good and purpose in life, and also thinking about the well-being and that of others. So you actually realize that that is mental health. Here in that definition, and I wanted us to look at that slide, it measures the perceived stress scale. There is a big version of that scale, which has more questions than that. But just reflecting on your own self and thinking about your stress levels in the last 1 month, what would you say? Question 1 says, in the last month, how often have you felt that you were unable to control the important things in your life? For me, I was saying last month was a little bit stressful. So I gave myself a score of 2. So sometimes I felt like I was unable. Then in the last month, how often have you felt confident about your ability to handle personal problems? Last month for me, it was a bit like, not really. Then in the last month, how often have you felt that things were going your way? Not so bad in that area. And in the last month, how often have you felt that difficulties were piling up so high? Not so much, I put it in the wrong, but still my stress score was a little bit high. I don't know whether you've looked at yours, you've been able to look at yours. Maybe you could put for us in the chat and see that that is how you've been scoring in the last 1 month. And as you're scoring that scale, for the 2 questions, you reverse the answers for the 2 questions in the middle, for question 2 and 3. Anyone who has been able to put something in the chat about how they have been feeling in the last 1 month? Okay, you can put it in later. But that is to make us realize that stress, we can all get stressed. There are times when we can all things like, you're not confident about handling personal, and here, and I'm not even talking about work problems. I'm only concentrating on personal problems. So what is stress? The person who coined stress in the medical sense says that everyone knows what stress is, but nobody really knows. And there are many definitions, and as I think as health professionals, we know all the definitions of stress. The one I've decided to use is that by Palmer, where stress is the psychological, physiological, and behavioral response by an individual when they perceive a lack of equilibrium between demands placed upon them and their ability to meet those demands. It's simplified in that slide by the WHO definition, which says stress is worry or mental tension caused by a difficult situation. Of course, here you have demands and resources. They are not matching. The pressure and the ability to cope is not matching. And there are many things that can cause us stress. Sometimes it can be daily hassles, like, have a presentation like this, and then the laptop goes off, and then you're like, okay, what do I do? That can be a daily hassle, electricity goes off. But there are other minor stress like arguments and uncertainty about the future. Then sometimes there are major life events and traumatic events. Some bit of stress we all know is good for us. I think the stress of having this presentation made me take a little bit of time to prepare and say, oh, what am I going to say? So it enhances some decision-making and creativity. But of course, stress can be negative, what they normally call distress, and that can be acute or chronic. I'm not going to go through the stress response. Sometimes I like making things simple, and sometimes I tell myself that sometimes I may not bother about the details of things, but at least you've all heard of the alarm, the adaptation and exertion response, the fight, flight response, but that is in the simplified way. I'm sure there are people here who can describe the mammalian stress mechanism even in more detail than I can do. So I'll not go into the stress response. I'll go straight to the effects of stress. And since we are talking about health workers, here we are thinking of workplace as well. So the threat of stress can be to the individual, their health, their well-being, their functioning, their esteem, their confidence, or to the organization where they are working. And stress may affect our feelings. It may affect our thinking, it may affect our behavior, and it may lead to bodily changes. There are bodily effects of stress. Probably I still don't have to go into the details of that, but some may be acute, some like chronic, feeling, we know, the breathlessness and feeling like you want to go to the loo when you have a presentation like this, or you have a major interview coming up. But then long term, we know that the effects of stress can affect many parts of the body and can lead to different diseases. Stress also affects our thinking. There's difficulty in concentration. There's difficulty in making decisions when you're stressed. Forgetfulness, you can be very sensitive to criticism, poor judgment, and then of course, cognitive distortions can occur. All nothing thinking, for example, I'll never be any good, or sometimes overgeneralization of your failures, or getting I should statements that can actually even lead you to more problems. Then of course, stress can cause emotional issues like anger, irritability, anxiety, depression, sadness, shame, guilt, even envy, by the way. And then there are behavioral effects like constant fidgeting, eating changes, sleep changes. Some people eat too much when they are stressed. I think for me, when I'm stressed, I actually sleep too much. Other people resort to drinking and smoking. And then there's avoidance of a particular situation. Sometimes I'm also an avoider. I don't want to face it. And sometimes we withdraw from others and we become inactive and neglect our responsibilities. I go back to the definition of mental health problems and mental health and mental illness. Remember, we defined mental health, the state of well-being in which an individual realizes her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So mental health is about how we connect, how we cope, how we function, and stress is key. But what about mental illness? Mental illness is defined a little differently. It refers to a wide range of conditions that affect the way we think, the way we feel, and the way we behave. And that usually causes social, occupational, or other disturbances that are observable by others. So in the next slide, you can actually see that someone can have a diagnosis of mental illness and yet be in good mental health with high levels of mental well-being. And another person may not have a diagnosis and yet be in a very low levels of well-being. So I think it's important for us to appreciate that. So when I was thinking of this presentation and mental health care, I actually decided to focus on mental health rather than going into severe mental illness. But why should we bother about mental health, especially for the workers? Generally, we know that mental health is a public health concern. Mental health concerns are widely unrecognized and unacknowledged. Mental health is associated with a lot of stigma. As a health worker saying that you have a mental health problem, there's a lot of stigma from everyone, whether you're working with people, whether you're treating people, there's a lot of stigma that is attached to having a mental health challenge. And then we know why we should address it is because when you access when you don't access care, when you access care, then there's a lot that can happen. There's reduced absenteeism, reduced turnover, increased productivity, and that has benefits for both the employer and the employee. Actually, it's been said that employees with depression can decrease the morale of their colleagues. You know, they tend to see everything as negative and, you know, not useful at all. So that's one of the reasons why we need to. But now we are going to work-related stress. And maybe we could put in the charts, what are some of those things at work that can actually lead to stress? What are those things in our work that can actually lead to stress? I don't know whether people can type in a few things that can lead to work-related stress. Underpayment, thank you, Prosi. Work overload, thank you, Thomas. Deadlines, thank you. Multitasking, compulsory assignments, sexual harassment, lack of career development, poor delegation. Yes, thank you, Fiona. Pressure from the supervisors, many deadlines, unresolved conflicts, insubordination, very much expected work, poor communication, corruption, burnout, pressure from the political wing. Wow, biased management, politician involvement, fellow workmates who don't complete their tasks, lack of teamwork, delayed pay, unmet job demands. Yeah, let them keep coming, stock out, quarrelsome workmates, deadlines. Yes, 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 yes. I actually don't have that comprehensive list, and I'm glad that people are participating in this because I don't have that comprehensive list. I don't have that comprehensive list. But we of course know there's shortage of health workers, heavy workload, high patient workload, role conflicts, personal threats, you know, penalty, institutional culture, leadership styles. There's a lot of things that can go on. Then there is communication problems within the organization, inadequate support, lack of autonomy and responsibility, inadequate training. Yeah, and I think I'll add on to that list everything that you have said. Some of them are individual, but others are institutional. Now let's reflect as Busoga Health Forum, people who are on this group. I know that they are health professionals, but probably we also have politicians, we have lawyers, we have religious leaders, we have administrators, then we have various cadres of nurses, doctors, pharmacists, professionals. We have academicians, we have researchers, we have clinicians. Even among all these groups, we have different specialties. So there are some stress that are unique to us, depending on what our profession is. And one of the things I realized is that you don't have a lot of studies in this area. Not that I've done a systematic review, I haven't. I really haven't done it. But you realize that if you just went out, even if you're just doing a Google search, you're not going to get a lot of information in this area. But I haven't done that search. But I just want you to think about your role as a member of Busoga Health Forum. What are some of the things that stress you that are unique to your role? Like for me, I'm a clinician. I'm generally a clinician. I'm a psychiatrist. And when I think of my work-related stress, it's related to that. I'm a clinician in Butabika. I head the clinical department. And my stresses may be related to that. So as clinicians, sometimes you may find that you need to make complex and complicated decisions. And sometimes the decision you make is very serious. It can lead to fatal consequences if it's a wrong decision. Sometimes there is uncertainty when you're making a decision because the information you have is contradictory. You are under constant evaluation. Then patient overload. I look at my work in Butabika, sometimes I'm like, oh, we have, not only me, we have so many patients. If we have 1,000 at any one particular time and you have a ward round of 60 patients or more, and interviewing them, you need 30 minutes for each one of them. And if you're going to use 30 minutes, how much time do you have? Then there is where you postpone making decisions, and that can actually lead to problem. For those who work in emergency care, even as we have emergencies, and then you have to act very fast. Then the external time pressure. So those can be things that are related to the unique role. Then there are disastrous consequences you think about, like I'm talking like a clinician and I'm thinking like, for example, patient suicide. I read a statement one time that, for us who work in mental health, that you're more likely to lose a patient by suicide if that we fall into different categories. A person who has never lost a patient by suicide, or another one who will lose if they practice long enough. and maybe it applies to everyone in the medical profession, that there are times when you lose that patient that you probably did not even expect to die. Then we worry about the litigations that are becoming very common, and then cooperation with staff. You've mentioned things about career advancement. Sometimes we make decisions for others, like fitness to practice and fitnesses that are going to affect other people. For example, you are responsible for being a witness for a major case. Sometimes you care for people you know, and sometimes you're like, oh my God, have I done this well? They are relatives, they are friends, they are workmates, they are colleagues. All that can cause a lot of stress. Then the daily routine is affected, like sleep, eating. Then there's the daily exposure to suffering, pain, and death. Then we don't have access. Sometimes as clinicians, we use the unconventional means of access to care. We self-diagnose, we self-treat, we self-prescribe. Then when you have a mental health challenge, the stigma, the fear of confidentiality. The other time I went to see a counselor and I was like, and I met someone I knew and I was like, oh, what are they going to think about me? You know, that fear of confidentiality. Then having the name of mental illness on your records. Then there's what they've been describing as the physician personality, tendency to perfectionism. We are hard workers, have difficulty to relax. And then, you know, exaggerated sense of responsibility to the patients, almost bordering to martyrdom. When you search Google, there's this statement about the expectation of a good doctor. If you're able to see the slide, I want yourself, whether you are a nurse or whatever medical health worker you are, I want you to put your name there instead of a good doctor and read that statement to yourself. I'll read it. Dr. Birabwa is attentive, analytical, brave, calm, cooperative, creative, decisive, energetic, ethical, friendly, gracious. Oh my God, I don't even want to read the whole list. Humorous. I can't be all that. But yet sometimes those are the expectations that people have of us. And yet we are human beings like others. Then there are those family and socio-economic expectations that lead us, you know, into a lot of stress. You are the doctor in the family. You are probably the one who is earning more than the other, and everyone expects you to, you know, do things in a particular way. And yet we are human beings with social, physical, emotional, and spiritual needs. Like someone said that the perception the society has of us is actually not matching with the reality. And that can cause us a lot of stress. And of course, as health workers, we can suffer from severe mental illness. That gives examples of common mental illnesses that people can suffer from, just as a reminder. Those are common mental illnesses, like adjustment disorders, anxiety, obsessive, depression, sleep disorders, alcohol and substance abuse. But we know that stress can actually exacerbate existing mental illness. And you can actually be a mental health worker and you also have severe mental illness. This is an old slide, but I'll still show it because I think mental disorders among health workers came in great light after the COVID, and everyone, you know, knew that the mental health workers needed support. And that slide shows that the rates of depression, at least in our country, in Kenya, which is very near us, were very high, 44.3 among health workers, and burnout was actually 45.8 among health workers in Kenya during the COVID. As health workers, we can also suffer from severe mental illness. It doesn't have to be associated with stress. One of my colleagues is actually looking at a comparative study of severe mental illness among health workers admitted to Butabika Hospital. I'm not going to preempt that discussion, and I'm not going to discuss severe mental illness in this slide, but we all know that as mental health workers, we are prone to that. And most of the severe mental illnesses, there's a lot of stigma attached to it. There are worries. Can I ever practice again? And if I practice, am I safe for my patients? And what will people look at me? The other issues we that bother people. Where do I get care from? Do we have really a special place for health workers to seek care from without them being stigmatized that they are seeking care with their patients? So those are things for us to look at, but I'm not going to go into that because I also know that the time we have for this is also short, and maybe we need further research and discussions around that area. So I'll just focus on work-related stress and its impact. Work-related stress can affect actually our professional quality of life. Sometimes you may be satisfied with your work, but sometimes you can have fatigue, burnout, and secondary traumatic stress. Compassion fatigue is referred to as emotional exhaustion, depersonalization, and lack of personal fulfillment at work as a result of continuous exposure to occupational stressors. And that is when helpers are unable to refuel or regenerate. So that can come as a way of neglecting your self-care, struggling with images and stories that you can't forget, exhaustion, disrupted sleep, anxiety, headaches, irritability, emotional disconnection, and difficulties with personal relationship. But sometimes we can have trauma, secondary trauma, like if you keep listening to traumatic stories, you can end up with secondary traumatic stress disorder, almost like PTSD, except that here, the trauma is being caused by you listening to another person's story who has experienced the trauma. And you can have intrusion, unwanted memories, flashbacks, and nightmares. You can have arousal symptoms, hypervigilancy, and then avoidance of any reminders to trauma. Sometimes with stress, we can get burnout, where there's a sense of emotional exhaustion, cynicism, detachment from work, and a sense of reduced personal accomplishment. Actually, I think the main difference between stress and burnout is the degree. So if chronic work stress goes unnoticed, then it can lead to burnout. Then there's this concept of moral distress or moral injury. I think we experienced that, first described by Shea in 1990 among the veterans. However, when we talk about the health professionals, you'll find that in moral injury among health professionals results from the challenge of simultaneously knowing what care patients need, but being unable to provide it due to the constraints that are beyond our control. So we know we need to fulfill our moral obligation of first not do harm, but the circumstances we are working in lead us not to be able to actually fulfill this. And that was common when COVID-19 was there and everyone needs oxygen and you're deciding whom should I put on the ventilator and whom should I not to. And that still happens, especially even in our setting. Then of course we know there's impact on the family. They get affected by our busy work, the limited social networking that may occur, and then we end up with disturbed relationships, negative emotions. We are flying very high career-wise, but then you find that your children are not doing very well because you've not given time to them. I wish I could say this, and I'm saying I'm not a culprit. I may also be a culprit in this area, but sometimes it's the stress that causes us to neglect our family. Then of course, work, misjudgments, increased adverse effects. You'll find that you'll not be able to follow the protocols and the guidelines. Risk of infections can occur, the quality and safety of care, then punctuality, absenteeism, poor work relations, job and career dissatisfaction, and then of course, other health-related effects. What we know is that stress actually decreases performance. Now, when we come to stress management, we can either reduce work-related stress, we can alter how people cope with stressful conditions, or we can treat stressed workers. I don't know what we want to do. Maybe we want to do the three of them, but if we have a presentation like this, it's helping us to actually reduce work-related stress. There's this questionnaire there, which is not very clear because of some writing on my screen. I don't know where they are coming from, but it's okay. But it's a stress questionnaire that can be used for nurses and physicians. And it actually talks about things that can cause stress, which you've already said. like maybe several patients dying at the same time, having to deal with aggressive patients. I'm picking out that because I work in Butavika Hospital. And then sometimes asking yourself, is there a benefit of my work? Sometimes we ask that when we have so many patients to see and you're like, oh, am I really making a difference? And then you feel stressed. You're like, am I really making a difference? And then of course, relatives, telephones ringing. Eh? Then sometimes you see the way your colleagues are treating patients. That can also stress you, lack of autonomous decisions. So there are a lot of things that can actually lead to stress. Now, when it comes to stress management, there are institutional measures that we can take, but there are also individual measures. I'm not going to go through the institutional measures, which we need to discuss possibly, but I think I'm going to end the presentation with individual measures that we can do. But before I show what I have on the slide, maybe I would want people to weigh in here. How do they cope with stress? How do they manage stress? How do they care for themselves? What do they find helpful? Maybe other people can learn from, we can learn from one another. What have you found helpful as far as stress management is concerned? Please, let's share. Let's share what has worked for you in terms of stress management. Socializing, thank you, Martin. Taking a walk in the evening, thank you, Grace. Games and music, sharing with close friends, thank you. Praying, listening to music, physical exercise, comedy shows, Wamala, thank you, Edwin. Taking leave, very important. Taking a hot bath, thank you, Akelo. Having time with friends, getting off work. Someone says peace of mind, driving, praying, seeking therapy, yes. Self-control in all situations, thank you, Ismail. Keeping quiet, Irema just keeps quiet. Swimming, attending CMs, games, going for a massage, learning how to live with others, spending time with friends, thank you, Julia. Compromising, nature walks, thank you. Games and walking around, yes, Rose. Dancing, yes. Decluttering, I like disconnecting to social media, meditation, a beer, yes, drinking alcohol. Okay, nice to hear all these things coming in. Human diverse, setting boundaries, thank you, Stella. Time with family, especially my children, thank you. Thank you, thank you all. Listening to music, thank you. Thank you, thank you, thank you for your participation in this. Ignoring, thank you, thank you. So I'm not going to say anything new. I think sometimes the difference, the reason why we don't do things well is because there is a gap between what we know and practice. Even when you hear a presentation, putting them into practice can be a different story altogether. Yeah, but I think I'm concentrating on self-care. And for health, there's physical care, there's social care, there's mental care. And you remember in mental health, we are talking about thinking, feelings, and behavior. Spiritual care is also important. Some methods we use for self-care are calming methods. Others are problem-focused, others are emotion-focused. So you've mentioned all these things, and maybe more. We talk about nutrition and dieting. I'm keeping this slide simple. Maybe I don't like complicated things, but if you look up in the internet, you'll see that there are benefits for all this, biological benefits that I'm not going to go through. To the extent that, you know, there's a relationship now being studied between the deity and the gut and the brain. So we won't go into that. Adequate sleep, I think I used to do very poorly in that. I would praise myself for being able to stay awake up to 3. But then the next day I wouldn't be functional. Now I realize that I actually need adequate sleep and I function better. I'm able to make decisions much better if I've had adequate sleep. People have given different examples of exercise. Rest, someone has given nature walk, another one has given warm bath. And yes, the literature shows that all that is helpful. I came across this saying by Hippocrates. Illnesses do not come upon us out of the blue. They are developed from small daily sins against nature. When enough sins have accumulated, illness will suddenly appear. And sometimes, I think when we talk about nutrition, sleep, this is really nature, rest. We are given the opportunity to sleep. We are given an opportunity to rest. We are given an opportunity to eat and have a healthy diet. Then, of course, in physical care, if you have a mental health problem, even a physical problem, because we know that some mental illnesses are as a result of physical illness, take a medical checkup, take your medication. That can help you quite a lot. Breathing exercises, meditation, mindfulness, these are calming exercises. And sometimes we know what the breathing exercise does. We know that when we are stressed, we are actually breathing very fast. And there's a lot that is happening in our brain that actually can be controlled by the breathing exercise. You don't have to wait to be stressed to do the breathing exercises. You don't have to wait to be stressed to do meditation and mindfulness and grounding. Those are very techniques that are helpful. When you're calm, you'll be able to make a decision. You'll be able to make good judgments. There is really a biological explanation to this, but I like simple things. Then, of course, some problems come because of, and you've already mentioned a number of things. We need good interpersonal and leadership skills. They can help us to overcome stress, setting goals, time management, you know. Sometimes we forget, like for example, one of the things that has been stealing my time is the phone. You sit down to prepare a presentation like this one, and then the phone keeps going off. Then you receive that call, then you see something that has been forwarded many times. Before you know it, all something that could have taken you 1 hour to 30 minutes to do, you're doing it for 3 hours. Sometimes we don't, and then you panic because now the time has come for you to give the presentation and you're not ready. We need to delegate. Sometimes, yeah, of course, as medical people, we want perfectionism, but there's where, you know, you have to accept if you have a presentation, it will not be perfect. Even this one is not perfect. Sometimes, you know, you have a presentation to make and then you take hours before doing it, you know? And sometimes we just need to say no. We just need to set boundaries and say, you know, yes, this is what I've decided. This is what I'm going to do. And you don't have to explain if you're really setting boundaries. Sometimes we just need to be assertive. Some communication skills of being assertive can be helpful in managing stress. Not being passive, not being aggressive, but really being assertive. And then, of course, decision-making. Sometimes daily routines help us. I'll give an example. If some people get bothered about what to wear, but if you know you've set that for the whole week, you won't bother. In the morning, you know what to pick, and then you'll be on time. I'm just giving that as a very simple example, but that can really help you so much. Then conflict resolution, problem-solving techniques. I know most of you have heard of them, but don't just hear about them. Use them. Use them. If you have a problem, think about the problem. And then say, what if this is the problem? What are the possible solutions? And think about the solutions and say, for the solutions, what are the benefits? What are the advantages? What are the disadvantages? And then go ahead and act. If it doesn't work, you know, it just hasn't worked. Okay? Then, of course, there are negative thoughts. Okay? Negative thoughts can occur. Even as medical professionals, you've lost a patient, maybe something is not going on well, you have problems with your supervisors, talk to a trusted family, talk to a friend. It may be a colleague if that patient is really bothering you about what you did well or what you did not do well. You may need to talk to a colleague about it. And then they make you see, sometimes that happens to me. And when I talk to a colleague, then I'm able to see the other side of the story. And then I end up feeling a lot better by just, you know, talking to a colleague. Sometimes you may need to speak to a therapist. I mean, looking for help really is good. And sometimes you just have to shift perspective, okay? Yeah, and you look at some situation and you're like, if I was giving advice to another person, what would I say? Sometimes what helps me is exploring the worst case scenario. If this has happened, what is the worst that can happen? And when I think of the worst and I feel like, well, I can cope with the worst, I find that their stress reduces a little bit. But sometimes if you're worried about litigation, for example, you can even die before the litigation comes. But when you think about it, what is the worst that can happen? Accept it. Maybe I'll lose my license. Accept it. We just need to learn to cope or cooperate with the inevitable. Expressing gratitude for positive aspects of your situation is key. Sometimes when I talk about gratitude, I feel as if we are becoming very, very spiritual, but actually, there's a lot of research to show that gratitude improves mental health. And I decided to do that. These days, I try to write at least 3 things I'm grateful for every day. And that helps me to actually be in good mental health. And some negative emotions, you just need to talk to a friend, focus on gratitude. Journaling helps. Journaling, by the way, there's scientific literature for all this. I remember in one of my case studies, I found that something like expressive writing can help someone to cope with emotions that they are not even able to talk to with another person. And then I think sometimes emotions, we just say, okay, I'll just live one day at a time. One day at a time. Some of us who have become old and we know that the years we have left are less than what we have lived. We realize the importance of living one day at a time. It reduces a lot of stress. And today I'll count myself, this has been a successful day because I've been able to give these presentations. About tomorrow, we shall see about tomorrow. And then the social network, variety. You have to have variety of social network. Sometimes it may be family, friends, colleagues. I have many friends, and actually even my friends are variety. There are some I talk to about a certain situation, then others about a certain situation. So you have to be creative. And when you have friends, appreciate them. Give time to them. Don't be the only person. You are not the only person receiving all the time. And be a good friend. Sometimes we even become stressed because we are envious of our friends and we think they are doing better than us. Try to be a good friend. That will reduce your stress. Then spiritual care. Spiritual care is also important because it gives us a sense of purpose and meaning. You saw in our definition of mental health, you need purpose and meaning. Spiritual care also identifies values. When you live according to your values, you're less stressed. Corruption, someone said corruption stresses them. Taking bribes, and sometimes you just have to say no if that is your value, that honesty is your value. And you live in better, you sleep a better night. Yes, of course, you may not be liked, but you have a better night and it will be good for your mental health. Spiritual care also gives us connections, and then it helps us to relinquish control. By the way, there's a difference between spirituality and religion. And actually, for some people, they define spirituality as, just having a sense of connectedness to a higher power, a sense of meaning. So even when, like, for example, when we are treating people with alcohol and drug abuse and we give them the 12 steps of Alcoholics Anonymous, we tell them, yes, relinquish control to a higher power, that you're now helpless and there's a higher power to help you. And of course, spiritual connections give us support. You can activate your spiritual care by prayer and meditation. People say that they find that helpful. Journaling, you can use scripture like, I can do all things, I will not worry, depending on your belief. You can talk to a spiritual friend or advisor. Sometimes when I'm going through stresses, I talk to my spiritual mentor and I'm like, this is what is happening. And then of course, nurturing your relationships, volunteering, random acts of kindness can help to improve stress. There's someone who say they use alcohol and drugs. I think those are things you want to avoid, especially when you're stressed. Okay, yes, it will make you feel good. Maybe you'll be able to sleep. But when you think of the benefits and the risks, you don't want to use alcohol to manage your stress. It's much easier probably than exercise. It's much easier to self-medicate than exercise, but the long-term effects can be disastrous. Sometimes we spend too much time online. We are comparing ourselves with others. Overeating, you want to avoid all that. And when do you seek for help? Is seeking for help a sign of strength or weakness? I think as healthcare providers, let's accept that seeking for help is a sign of strength and not a sign of weakness. There are some references there. I don't think I have said anything very new to you people. But I think you'll be more blessed, like the Bible says. If you know these things, you'll be blessed if you do them. You may know them, but you may not do them. Mwevale ino.